Hello, my dear future nursing officers. I welcome you all once again back to the Master Nursing classes. In this very important session, we are going to discuss and deal about a very important concept that is again most necessary for our exams. So that including the image-based questions, concept-based questions, scenario-based questions, one-liner questions, and the questions which must and should we need to read and repeat before the exams. So those questions with the clarity of the concept and the golden points we are going to revision today here. And I welcome you all once again back to the Master Nursing classes. So please do share the class with your friends and with to your WhatsApp status as well, and hit the like button who all are live to the session. So we're going to start the session without wasting a single minute of the time. Yes, so can we start the session? I hope everything is fine, and I'm going to start the session now without wasting your time. And here it comes to a first question in front of you all. A very good evening to one and all. So fटाफट hit the like button and let's begin the session, because we have the less time for the exam and we need to cover more important more thing are there. Okay, so we will try to finish that one, right? So here it comes to the a very important first question in front of you all. So this is the image number A. I want every one of you to please do comment the name of this image which is there in front of you. Option A, I'm giving, is this a lipase loop, or is this a copper T 380A, or is this a hormonal IUCD, or is this a multi-load? What is your answer? Multi-load, hormonal IUCD, copper T 380A, or lipase loop? What is your answer? Yes. So this is the image of a very important multi-load copper T, not copper T, it's a multi-load copper 375. So why should not I tell this one is the copper T? Because it is not in a T shape. We can see this is not in a T shape. T will be like this, right? It is not in a T shape. So sir, which generation IUCD is this one, sir? All copper IUCD are the second generation. Okay, so this is the intrauterine contraceptive device which we have the copper on the body. Okay, so all the copper which is including the copper T and multi-load, this comes under the classification of the second generation IUCD. So we have the IUCD in first generation, second generation, third generation. So first generation IUCDs are almost outdated and we are not using now. So you can see in the first generation IUCD we have this one. So this is the lipase loop. Are you able to see the double S shaped structure? So which is there here? This is what you call as in the lipase loop. So this is lipase loop. Okay, so this lipase loop is the first generation IUCD, and now use of this lipase loop is outdated. So the question from here is very least expected, and we can say there may be a very less chance of striking the question on the lipase loop. So just understand the image. So the double S shaped intrauterine contraceptive device we have is the only one device which is there in the double S shaped intrauterine contraceptive device, that is the lipase loop. Okay, so these are basically a IUCDs, that is the intrauterine contraceptive device. Means these small devices we are going to insert inside the uterus of the mother, and which is going to act as a contraceptives. Okay, so these lipase loops are the first generation which is made up purely by the plastic. So after insertion of this one, which will be creating the inflammatory reaction and which is blocking the sperm to get entry into the uterine cavity, and these are the we can say this is the least effective one. So because it is not going to show the best result, so this first generation IUCDs or the lipase loop is now outdated. Okay, and here we have the second generation. So in the second generation we have the copper T and the multi-load. Okay, so this multi-load we can say it is similar like a copper T, but it is not in the T shape. Okay, so the T shape will be like this. So that is the copper T. So here we have the wing like structure, you can see here. Okay, so this is to prevent the expulsion. Why it is having the finger like projections here? So this is to prevent the expulsion. Okay, so means after inserting it should not easily come out. So that is the main purpose. And what is the purpose of the thread? So we have the thread to all the IUCD. You can see for the lipase loop also threads are there. For multi-load also thread are there. And I will show the image of the copper T. So you can see this copper T. This copper T also having the thread here. What is the purpose of this thread? There are the two very important golden points you have to keep in your mind on the threads. One, this will help to locate the position. So if woman is palpating this particular thread which is there in the vagina, which means the copper T is in its normal position. If woman is palpating and she is not getting the thread, so it means the copper T is not in the uterine cavity. It may enter into the abdominal cavity, or it may like dislodge from its normal original position. Okay, so another thing is this one is helpful for the removing the IUCD, and one thing is this one is helpful for the identifying the position of the IUCD. These are the two things you have to keep in your mind. Okay, so this is the thread which is having here. Okay, so this thread is useful for the two things. One is to locate the IUCD, another one is to remove the IUCD. Okay, so next we have is copper T 380A. So what is the meaning of this copper T 380A? Why we used to call 380A T copper? So like this. So you can understand here, copper means this intrauterine contraceptive device which is having the copper on the body. So that is what you can say as the copper. Sir, why we used to call this one as a T, sir? T because the shape of this IUCD is T in the shape. So that is the reason I have written the 3 T here. Sir, why we used to say 380, sir? 380 in the sense on this particular IUCD. So you can see on this particular IUCD. So the copper which is there, how much copper is there? It is there like a 380 millimeter square surface area of the copper we have. So here we have the 380 millimeter square are the having copper. So on this particular device, so that is the reason 380 we have written here. So why A, sir? A in the sense this is we consider as the arm of the our copper device. So this is arm also containing the copper. So that is the reason we have the A here. So are you getting the point? Copper because it is made up of the copper, and the T because it is in the T shape. 380 because the amount of the copper is the 380 millimeter square surface area, and A because arm also containing the copper. So that is the reason we call this one as the copper T 380A. So one very important thing to be keep in our mind regarding the copper T 380A is, so once we insert this one, so this is used for the duration of the 10 year. So we can use this one for the duration of the 10 year and frequently asked question. So this is the frequently asked question you must and should remember and give the best answer in your exams. Okay. And here we have the third generation. So here we have the third generation intrauterine contraceptive devices. So on this one, here also we have the thread. Are you able to see? Here also we have the thread. Okay, yes sir, we have the thread. And this is very importantly not having any copper. So you can see here we have the a very important hormone. So the third generation IUCD what we have is the hormonal IUCD, not copper IUCD. The plastic one is the first one, that is the first generation IUCD. I have given the example of the double shaped double S shaped intrauterine device, that is the most important one, lipase loop. And the second one is the copper devices, where the second generation what we have discussed, in that one we have the copper T and the multi-load. And in the third generation, so these are the third generation image what you are seeing on the image. So this is the hormonal IUCD. So this is a third generation. Okay, so first generation is lipase loop, second generation is the multi-load and the copper T380, and the third generation we have is the hormonal. Okay, so this hormonal IUCD we also call as the Mirena. We also call this one as the Mirena. Okay, so Mirena is the hormonal intrauterine contraceptive device we have here. Okay, so which hormone is predominant in this one? So the levonorgestrel will be there. So how much levonorgestrel it will be there? So that is the per day 20 microgram of the levonorgestrel will be released from this particular hormonal IUCD. So we also call this one as the LNG20. So LNG20 means this is having the levonorgestrel hormone, that is the progesterone hormone, and per day it will release the 20 microgram of the our what you can say progesterone. So this is a Mirena or the hormonal intrauterine contraceptive device what we have here. I hope it is very much clear, all the images. So this is the third generation we call Mirena. This is the second generation copper T380A, and this is the multi-load. Okay, so this is the very important, and the lipase loop. Okay, so lipase loop is first generation, multi-load and the copper T380A is the second generation, and here we have the hormonal, that is the third generation. These image based questions are the very important and very important for your exams. You may expect one or two questions from here. Okay, so here is the simple and very important classification. Okay, so on the classification what we have, this is the first generation what I told, the first generation which is having the non-medicated, there is no any medication, so just there is in the double S shaped structure which is having the plastic device. Okay, so that is the lipase loop. So after inserting this lipase loop, how it used to work? So it is acting as a foreign body to your uterus, and in the uterus there is an inflammation, so that is not allowing the sperm to get enter into the fallopian tube and until the ovary. So that is the very important thing. Okay, so here we have lipase loop as the first generation, and the second generation already we discussed this. In the second generation we have the copper bearing IUCDs. So that is the one which is there in the copper bearing IUCDs. So one which is there in the copper T. So that is the copper T380, which is in the copper T 220B. So these are the T shaped. Okay. So the second generation which is in the T shaped, that is the copper copper T380A and copper T220B. Okay. And here we have the copper IUCD which is not in a T shape, that is the multi-load. Okay. So that is the multi-load copper 375. Okay. So this is contains the copper but not in a T shape, and it is the flexible arms which is having. Are you getting the point? Yes, sir. And here we have the third generation IUCD, that is the hormonal, which is having the Mirena. So that is the liver norgestrol hormone is there. So that is, I also told you, that is the LNG20. Okay. So I hope you are very clear about the three generation of the intrauterine contraceptive devices. And here it comes to the next very important question. So please do read the question carefully, completely, properly, and try to give the best answer. Already I have told the answer for this question. So just I want to make sure that you understood or not. Okay, so how long can a copper T380A IUCD be effectively used for the contraception? So once we inserted, one time we inserted means for how many years we can use this particular copper T380A? Yes, very nice of you, very nice of you. So that is the once we inserted means it can be used for the duration of the 10 years. So this is very important. So that is the reason all the IUCDs, especially the copper IUCDs, which will comes under the LARC, that is the long acting reversible contraceptives. Okay, so these are the long acting reversible contraceptives. And here it comes to the table, and very important for your exams. So very important for your exams, don't neglect this particular table. Okay, so what it explaining is, so we have the copper T380A, when we have to replace this one, so we have to replace this one every 10 years. And we have the Mirena, that's the liver norgestrol. So when we have to replace once after insertion of the liver norgestrol or IUCD or the Mirena IUCD, that is every 5 to 7 years. So one single best answer you can consider as the every 5 years. Okay, and we have the progestate. So this progestate also in the hormonal IUCD, but it is now not using, this is outdated, and because this one requiring the very frequent insertion, so this one we need to replace every 1 year. So this is practically challenging and practically impossible one for the long term who all are require the long term contraceptives. So for them it was the difficult, because every year one time we are like taking the patient and making the sterile procedure and inserting that, so that is the practically challenging one. So progestate is now outdated, this is now not using, this is now outdated, and it should be replaced every 1 year. And we have the multi-load, that is the copper 375. So this one should be replaced every 3 years. So this is a very important table for your exam, and from here you may get the question. So yes, repeat with me, when we have to replace the multi-load beta, the multi-load copper 375. So when we have to replace that one, every 3 year, one time we have to replace the multi-load. And Mirena 5 to 7 years. So one single best answer 5 year. Copper T380A every 10 year we have to replace. Progestate outdated because it requires a very frequent insertion every 1 year. That is practically challenging one. So the progestate IUCD is now outdated. Okay, getting the point? Yes, is that clear? Is that clear to every one of you? Yes. So here it comes to the next very important concept, mechanism of action of the IUCD. Here you have to understand the two very important things. IUCD works by preventing the implantation and preventing the fertilization. Sir, how IUCD will prevent the implantation and how IUCD will prevent the fertilization? Just understand. And in your exam, if the question is coming how IUCD will work, especially the copper T IUCD, how copper T IUCD will work. So copper T IUCD works by the two very important things. One by preventing the implantation, another by the preventing the fertilization. So you understand how it will prevent the implantation. So that is once we insert the copper IUCD, so it will releases the copper ions. These copper ions will mix with the cervical mucosa. So hence it will mix with the, when it will mix with the cervical mucosa become very thick and it is very tight. Okay, and if the thick cervical mucosa is blocked the cervix, there is no entry of the sperm into the cervix. So sperm entry into the uterus is blocked. So sperm entry into the uterus is blocked means there is no entry of the sperm, means there is no fertilization. So that is the very important thing you have to keep in your mind. IUCD works by preventing the fertilization. Okay, yes sir. And these copper ions which are releasing here, these are very harmful to the endometrium. So the inner layer of the uterus, endometrium. So to that endometrium, this particular copper ions are very harmful. So it will make the endometrium for imbalance, and it will make the like inconsistency in the endometrium where the implantation will not happen. So it will prevent the implantation. Very important two mechanisms of the copper T IUCD. One by preventing the fertilization and one by preventing the implantation. So I hope it is very much clear. Okay, and here it comes to the next question. So try to read the question carefully, completely, perfectly, and try to give the best answer. Yes, just already discussed the question. So just you want to make sure that you have to give the correct answer for this one. So here, in addition to the inhibiting the sperm, what is the another mechanism by which the copper IUCD prevents the pregnancy? So the question was very simple. Just I have discussed the copper IUCD mechanism of action is the two mechanisms we have. One, it will inhibit the sperm entry by blocking the cervix by thickening the mucosa, so that prevents the fertilization, right? So that in along with, in addition to that one, what is the another mechanism by which copper IUCD prevents the pregnancy? Yes, I told it is making the inconsistency and altering the endometrium layer, and it is not allowing to get implantation. So this is the very important option. Is that inhibiting the ovulation? No, it will not inhibit the ovulation. So inhibition of the ovulation is the oral combined pills. Primary mechanism of action of the oral combined pills is that will inhibit the ovulation. And thickening of the cervical mucosa. Yes, this will make the cervical mucosa thickening. And the question is asked very simple. You understand here. The question not asked how it will inhibits the sperm entry. They have asked in addition to inhibition of the sperm entry, what is the another mechanism? What is the another mechanism? So this mechanism already given in the question. So what is the another mechanism by which the copper IUCD will be work? So that this one will work by altering the endometrial layer. So one mechanism is that will be thickening of the mucosa, that is already given in the question. So in addition to that one, what is the another mechanism where the copper IUCD will prevent the pregnancy? So another mechanism is by altering the endometrial layer. So it will prevent the pregnancy. The correct answer for this particular question goes to the option C. Okay, yes sir. And here we have the next question. Which of the following is a common hormone found in the hormonal IUCD? So we have the first generation plastic one, non-medicated. Second generation copper, that is the copper T, copper T and the multi-load. And in the third generation, I told hormonal IUCD we have. So in the hormonal IUCD also I have discussed in front of you all in detail. So with the image also. So which of the following is a common hormone we have the in a hormonal IUCD? In the hormonal IUCD, which of the following is the common hormone we have? Yes, Fadafat, do mention your answer. Is that estradiol? Is that the progesterone? Or is that levonorgestrel or ethylene estradiol? So what is the correct answer? Yes, very nice. So that is the LNG or the levonorgestrel we have in the hormonal IUCD. So especially we have the LNG20, that is the LNG20. It means the levonorgestrel. So that is releasing 20 microgram per day. So that levonorgestrel or the progesterone. So that is going to be act as the hormonal IUCD. So how it will act? So understand here the golden points and the very important points on the hormonal IUCD. These are the third generation. These are the currently using. These are the most trending. And from here you may get the question. So read this one perfectly, properly, and revise this one multiple times. So especially hormonal IUCD and the centrochromen, that is the recently added one. Centrochromen, that is, these both are very important for your exam, especially hormonal IUCD and centrochromens. Okay, so very important golden points on this particular hormonal IUCD I want to talk is, these are the intrauterine contraceptive devices which is having the hormone. So which hormone which is having? That is the levonorgestrel. So that is the a form of the progesterone. Okay, this is the third generation intrauterine contraceptive device. So example we can say is the Mirena. So we also call this one as the levonorgestrel releasing IUCD. Okay, and here it is containing the hormone. We call this one as the levonorgestrel or the progesterone. So that is LNG20. So that is the 20 microgram of the levonorgestrel is releasing per 1 day. Okay, so what is the mechanism of action? You know, the progesterone is releasing means progesterone will makes the cervical mucosa very thick and which blocks the sperm entry. Okay, and another thing, the cervical mucosa, sorry, the endometrium is getting altered and it is preventing the implantation. These are the two very important mechanism of action of the our hormonal IUCD. Okay, so once we insert the hormonal IUCD, so what is the duration we can use this one? So we can use for the duration of the 5 to 7 years. The single best answer I told, that is the 5 years. Okay, yes sir. And what is the effect of this particular hormonal IUCD in the menstrual effect, sir? Yes, definitely it is having the effect on the menstrual cycle because we are using the progesterone. Sir, what it will causes? The progesterone is there which is continuously supporting the endometrium and it is not allowing to rapid shed out. So there is in the very less menstrual bleeding is there. Okay, very less menstrual bleeding, and sometimes it will cause the absence of the menstrual bleeding, that is the amenorrhea. So the patient is having the less menstrual bleeding or the amenorrhea is there. So can I use this IUCD as a best option in a patient who is having the menorrhagia? So where there is in the excessive menstrual bleeding is there. So there can I use this one as the best IUCD? Yes sir. Why? Because once you inserted the hormonal IUCD, that is continuously releasing the progesterone. So that is 20 microgram of the progesterone per day it is releasing. So that is making the menstrual cycle to, like, menstrual bleeding to bleed very less, and it is causing the amenorrhea, that is the absence of menstrual cycle sometimes. So can I use this particular IUCD as the best method of the IUCD in a female with heavy bleeding, that is in the menorrhagia? Yes sir. So the question is, which IUCD is best in a female with a heavy menstrual bleeding? That is the hormonal IUCD is used as a best in a heavy menstrual bleeding or best in a menorrhagia patient because it is having the side effect of the light menstrual bleeding or amenorrhea. So in a menorrhagia means excessive menstrual bleeding is there. In that one I am using the hormonal IUCD means it will causes the normal menstrual bleeding. So that is the reason this is the best option. Okay, yes sir. And this is the one of the highly effective long-acting contraceptive device. So that is the very important you have to keep in your mind. This is among the copper T, among the multi-load, lipase loop, hormonal. Which one is the best highly effective long-acting reversible? Means that is the hormonal IUCDs, highly effective long-acting reversible, because these are having the very less and very less failure rate. So that is the reason. Okay, yes sir. And here it comes to the next question, and this question is very important for you all. Please do read the question carefully. This is not related to the hormonal IUCD. This is related to the copper T. Okay, so it is not related to the Mirena. It is related to the copper T 380A. Okay, so what is the most common side effect after insertion of the copper T 380A is the question. So there is insertion of the copper T380A intrauterine contraceptive device have been done. What is the most common side effect after insertion of the copper T? So what is your answer? This amenorrhea or decreased menstrual bleeding is the side effect of hormonal IUCD. This is the side effect of hormonal IUCD. So that is the reason where in the menorrhagic patient the hormonal IUCD are best used. So the now question is not asked about the hormonal IUCD. They are asked a question on the best side effect or the most common side effect on a copper T380A. What is the most common side effect of the copper T380A? So that is very important thing to be keep in our mind. The hormonal IUCD decreases the bleeding and copper IUCDs increases the bleeding. Increased menstrual bleeding or the menorrhagia is there. So this is the most common side effect of the copper T380A insertion. Okay, and we have the another options, severe infection. It will not going to cause the sudden severe infection. And option D is there, pain in the abdomen. Pain in the abdomen is, this is the most common reason for the removal of the IUCD. We inserted the IUCD, patient went home, and she used to get the mild abdominal discomfort continuously, pain in the abdomen. So she will come back to the hospital, sir, I don't want this one, it is causing the pain in my abdomen, so please do remove this one. So if that someone is asking you a question, what is the most common reason for removal of the IUCD, especially copper IUCD, that is the pain in the abdomen. Pain in the abdomen is the most common reason for the removal of the copper IUCD. So now you tell me, so this particular copper IUCD can I use in a patient with anemia? So I want your answer in the comment box. The patient with anemia is there, the patient is having the anemia. In that anemic patient, can I use this particular copper T380A? Yes or no? Absolute and 100% answer is no. Sir, why? The patient is already having the anemia, that may be a low RBC or low hemoglobin is there. And you know the copper T380A is having the most common side effect, that is the menorrhagia, the bleeding is there. So already hemoglobin and RBC are less and bleeding is happening, means it will worsens the anemia. So this is not used in the anemia, the not recommended IUCD in the anemia. Okay, so copper T380A is not recommended in the anemia. So this is not recommended in anemia patient. So very important line for your exam, so don't forget this one. Okay, so can I use the hormonal IUCD? Yes, I can use the hormonal IUCD in a patient with anemia, because that is not having any bleeding. Okay, so these are the some golden points you must remember for your exam. The most common side effect of the copper T380 is the bleeding, that is the menorrhagia. So that is the reason not recommended in the anemia patient. Most common reason for the removal of the copper T is the patient complaint of the pain in the abdomen. This is the most common reason for the removal of the contraceptives. And most common side effect of the Mirena, that is the hormonal IUCD, that is irregular bleeding or absent of the bleeding or the low bleeding. So this bleeding is low, means can I use this one in the patient with the heavy bleeding? Yes. So best in the heavy bleeding is the Mirena or the what we can say, hormonal IUCD. Okay, so that is the very important thing, just you have to keep in your mind, right? Yes sir. The next very important question is here. Read the question properly, perfectly, and try to do the best answer. Which of the following is an absolute contraindication of insertion of an IUCD device? So what is the most absolute contraindication where we should not insert the IUCD? Which of the following is an absolute contraindication for insertion of an IUCD? Option A, multiparity. So there is no any contraindication with the multiparity. In a multiparous woman also we can insert the IUCD. There is no contraindication. Previous cesarean section, no, not a contraindication, we can insert. Above the 35 year is not a contraindication, we can insert. But if the patient is having the pelvic inflammatory diseases, we should not insert the IUCD. This is the very important thing you have to keep in your mind. In an active pelvic infectious disease or in a previous history of the PID, the IUCD is not recommended one. So this is the very important thing you have to keep in your mind. Which of the following is an absolute contraindication? That is the pelvic inflammatory disease is there actively. So this is the absolute contraindication disease of absolute contraindication of the insertion of the intrauterine contraceptive device. So I hope it is very much clear to every one of you, right? Yes sir. And here we have the very important contraindication of the IUCD insertion. So that is contraindications which are related to the infection. So if there is a mother, if there is in the female is having the current or previous history of the pelvic inflammatory disease, insertion of the IUCD is contraindicated. If the female is having the puerperial sepsis, that is in the postpartum periods, there is an infection of the uterus, so that is the puerperial sepsis is there. So that time also insertion of the IUCD is absolutely contraindicated. And the contraindicated which is related to pregnancy, if currently woman is pregnant Okay, so currently woman is pregnant means in her we are inserting the IUCD means it will cause the abortion. So current pregnancy insertion of IUCD is absolutely contraindicated. And if the female is having the past history of the ectopic pregnancy, and past history of the molar pregnancy. So in these three situations, one in a current active pregnancy, IUCD is contraindicated. Past history of the ectopic pregnancy, IUCD is contraindicated. Past history of the molar pregnancy, IUCD is contraindicated. So these are the three very important things, that is contraindications related to pregnancy in IUCD you have to remember. And contraindication related to bleeding. There is an undiagnosed abnormal uterine bleeding is there. Continuously bleeding is happening through the uterus. So that is we have not diagnosed what is the problem behind this one. And if the bleeding is happening due to the cervix cancer, again this is the contraindication. And if the bleeding is happening due to the endometrial cancer, so that time also insertion of the IUCD is absolutely contraindicated. Contraindications related bleeding, contraindication related to the pregnancy, and contraindicated related to the infection. These are the very important contraindications of the our copper T and Mirena both. Okay, so these are applicable to the both Mirena and copper T. So that's the contraindication of the IUCD. So this is a very important table you have to understand here. Okay, you can take, if you want, you can take the screenshot also, right? You can take the screenshot from here. Then yes, so the next very important is here the golden point. So what copper T's are having? So copper T is having the copper, and we have one disease in our body where there is the excessive accumulation of the copper in the organ level, especially in the liver and in other situations. What is that called as? So that is we call as the Wilson disease. What is the Wilson disease? Wilson disease is accumulation of the copper in the organ tissue. So that is called as the Wilson disease. So already there is an overload of the copper is there. So can we give the copper T devices to a patient with Wilson disease? No. So copper T is absolutely contraindication in the patient with the Wilson disease. Very important point. And Mirena is having the progesterone. So that means stimulates the breast cancer. Mirena is contraindicated in the breast cancer. These are the two very important golden words you must and should keep in your mind and understand for your exams. Okay, yes sir. The golden exam point, copper T is contraindicated in the Wilson's disease and Mirena is contraindicated in the breast cancer. This is a very important point you have to keep in your mind. And here it comes to the next question. So try to read the question and give your best answer. In a woman who has not delivered recently, what is the best time of insertion of the copper T devices? There are the two situations where we will insert the copper T devices. One immediately after the delivery and one is in a non-pregnant woman, so who she have not delivered recently. Okay, there is no any recent deliveries are there. So in that woman we also use the IUCD, and after delivery also we also used to use the IUCD. So now you have to tell me the answer. Best time for insertion of the IUCD. What is the best time? Option A is there during the ovulation. Option B is there immediately after the intercourse. Option C is there during the menstruation, that is within the first 5 days of the menstrual cycle, and option D is there after menopause. So what is your answer? Can we insert the IUCD during the ovulation, that is in the mid of the cycle? So during the ovulation, is that internal os is open? No sir, it is mid of the cycle, that is ovulation happens on the 14th day. So that time very importantly, internal os is not open. So if you are trying to insert the IUCD that time, so there is in the pain is there in the uterus, so that is more pain will be there, more discomfort will be there. So if we insert in the mid of the cycle, so during the ovulation we can't insert this one, so this is the wrong answer. Then option B is immediately after the intercourse. Immediately after the intercourse, if you are inserting the IUCD, so that is yes, IUCD, the copper devices which will work as the emergency contraceptives. But here there is no any situation, and in the question they have not given the what we can say emergency situation. They have just asked what is the best time. So this is not a best time. Immediately after intercourse is not best time. If there is unprotected sexual intercourse, So we can use the IUCD, especially copper devices, as a emergency contraceptives, where we can insert that one in a within 5 days. Okay, so for copper teeth, within 5 days we will insert the after the unprotected intercourse. And other methods we have the emergency e-pill, so that is we have to give within 72 hours is the best. Okay, so I will discuss about the emergency contraceptive also in a very perfect. So best time is, yes, almost all you people given the correct answer, that is the during the menstruation, because menstrual blood is coming out of the uterus, means internal os is open, so that time we can insert very easily and patient will be having very less discomfort. Okay, so within the first 5 days of the menstrual cycle we used to insert the, or during the menstruation we used to insert the our intrauterine contraceptive device, because the internal os is open, the IUCD will go easily inside and there is no pain and discomfort to the patient. And here you understand this particular table. So here we have the very important table, so that is best range answer of insertion of the IUCD, that is for the first 10 days, first 1 to 10 days of the menstrual cycle. So that is a best time. Okay, so that is the answer in a range. Okay, so from the day 1 to the day 10 of the menstruation we can insert. So if you want the single best answer, that is the first 55 days of the menstrual bleeding. Okay, this is the single best answer. Okay, so why? Because in this first 5 days there is in the completely open os we have, so we can easily insert. So what is the reason behind this one? That is, I told, internal os of the cervix is slightly open. Okay, so we can insert this one during the menstruation. So because the os is slightly open here, what is the advantage? If we are inserting in this particular period, easier and less painful to IUCD insertion. And additional benefit we have is, if menstruation is happening, bleeding is happening, it means the woman is non-pregnant. Okay, so pregnancy is very unlikely during the menstruation, because IUCD we can't insert during the pregnancy, right? So that is the reason the pregnancy is very unlikely during the this menstruation. So that is the reason this is the best period. Okay, that is the reason this is the best period. I hope you got the complete clarity about the when to insert the IUCD and why we have to insert the IUCD in that particular time only. And here it comes to the next very important question. Yes, the very important last question, also a 10-star topic. So this is the 10-star and very important topic. And here what we have discussed the revision table. This is also very important. And here it comes to the next question. This is also the most important. Okay, this is also very important for your exam. So stay focused and read the carefully and give the best answer. A woman has recently delivered a baby and is considered IUCD insertion for contraception. So what happened here? The woman is recently delivered a baby and is considering the IUCD insertion for contraception. And which of the following is the statement regarding the time of the IUCD insertion is not correct? So question is not correct. So that is after the birth. Recently given the birth to the baby. So after the birth, we are inserting the IUCD insertion. Okay, we are planning for IUCD insertion. So which of the following given statement is wrong or not correct about the IUCD insertion? Option A is that we have to insert the IUCD immediately after the delivery of the placenta, that is within 10 minutes. Is that correct? Yes, sir. So this is 100% is correct. So we call this one as the post placental IUCD insertion, and this is Government of India recommends this one only, but the major problem is there is high risk of the expulsion, so it will comes back once we insert. Immediately after delivery of the placenta we are inserting, and within 10 minutes we are inserting, that is the post placental IUCD we have. Okay, so major problem is it will expel out easily. Okay, so next we have is after 10 minutes and within 48 hours after the delivery. Is this correct? Yes, so it is also correct. We call this one as in the postpartum IUCD insertion. This is what we call as the postpartum IUCD insertion. This is called as the postpartum IUCD insertion. Yes, yes, sir. And we have a very important third word, that is the between the 48 hours to the 6 week. No, this is not a correct statement. This is not a very important, what we can say, uh, this is not a time of insertion of the IUCD, because here there is the highest risk of the infection and highest risk of the expulsion of the IUCD. So once we insert after 48 hours. So if you want, you can insert within 48 hours is the best. That is immediately after placenta delivery, within 10 minutes is the post placental IUCD, and after 10 minutes within 48 hours you are inserting postpartum IUCD, and after 6 weeks of the delivery you are inserting, means this is the interval IUCD, this is the interval IUCD. Okay, so these are the recommended timings after the delivery we can insert the IUCD, and this is not a correct statement. Option C is not a correct statement, and almost all you people given the correct answer. Between the 48 hours up to 6 week of the postpartum we can't insert the IUCD, so this is the correct answer. I hope it is clear to every one of you, right? So here is the quick revision table for you all. So understand the table, it is very important. So that is what is the post placental, just I have told post placental IUCD insertion. This is recommended by the government of India. Okay, so that is within 10 minutes of delivery after the placenta. So after delivery of the placenta, within 10 minutes we are inserting, that is the post placental IUCD. From 10 minutes to 48 hours after the delivery, so this is called as the postpartum IUCD. This is called as the postpartum IUCD insertion. And 48 hours to the 6 week, not recommended to insert. It is not recommended to insert. And after 6 week, we are inserting, means that is what we call the interval IUCD. This table is very, 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 very important for your exam. This is very important for your exam. So please do keep in mind. And here it comes to the why we should not insert the after 48 hours up to the 6 week, because there is a high risk of the infection and expulsion is there. IUCD should not be inserted between the 48 hours to 6 week, because here there is a high risk of the infection and expulsion of the IUCD. So I hope it is very much clear. And here it comes to the next very important question. So try to read the question properly, perfectly, and try to give the best answer. Yes. So question is very simple and very important. The usual dosage schedule for the centrochromin is, what is the usual dosage schedule we have for the centrochromin? So this centrochromin is one of the trending and very important contraceptive. So that is, we have the oral contraceptive, this one, which is very, 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 very important, because this question came in the Norcet 8, Norcet 7, Norcet 9 continuously on 3 different forms. And in your Norcet 9, there was a completely confusing question where they have asked what is the another name of the centrochromin. In the option, they have given both Saheli also, Chaya also. So then what to choose? What was the correct answer for that one? So I will say, I will give the complete clarity, so that will be helpful for you all, and you try to give the best answer for this one. So what is the usual dose schedule of the centrochromin? So the usual dose schedule of the centrochromin is 1 tablet we will give every day. Is this a correct? No, this is not a daily contraceptive. 1 tablet weekly? No, 1 tablet weekly is not a correct statement. So we can say 1 tablet monthly. This is also not correct statement. So then how we have to give, sir? So this is the very important. 1 tablet twice a week for the first 3 months. Then weekly we can give. So then once weekly we can give. So this is the one single best answer which you have for the dose schedule of the centrochromin. This particular centrochromins we also called as the Chaya. We also called as the Saheli. So let me discuss all the very important golden points on the centrochromin. What is the centrochromin? What actually ingredient which is have inside? Is this a hormonal or the non-hormonal? Is this a steroidal or non-steroidal? So what is the chemical which is there inside? And what is the dose schedule? How we will give? What is the another name? So this is very important. We will discuss this one with the golden point revision. So understand the very important first point on the centrochromin. So what is the chemical name of the centrochromin? The chemical name of the centrochromin is the ormeloxifan is the chemical name of the centrochromin. This is very important for your exam, and from here you may expect one question in the exam. That is centchromen. So centchromen, another name is ormeloxafen. So ormeloxafen is the another name of the centchromen. Okay, so this is the non-hormonal, non-steroidal oral contraceptive. This is not having any kind of the hormone. This is not having any kind of the steroid. So this was your ESIC individual exam that was called from through the UPSC. In that one, they have asked one question on the centchromen. You see. So which of the following contraceptive is a non-hormonal and non-steroidal? So that is our centchromen or the ormeloxafen is the non-hormonal and the non-steroidal. Okay, so very importantly, here we have this is the selective estrogen receptor modulator. This is the SERM. So here we have the another drugs also like tamoxifen citrate, raloxifene citrate. So those all are also comes to the category of the selective estrogen receptor modulators, right? So here SERM category. So it is having the one more, that is the chemicals that is the ormeloxafen. Just it will work like a hormone, but it is not a hormone. It is not a hormone. So this is given once weekly oral contraceptive pill. So this is for the after 3 months. This is after 3 months of starting. So we can say once weekly contraceptive also we can say, but it is not a standard statement, but it is mentioned in the book and one time asked a question also, but that is incomplete question. So the actual schedule of this one is the very important. You have to understand here the dose schedule. That is the first 3 months we have to give 2 times in 1 week. That is the twice weekly 30 mg tablet we will give, and after the 3 months that is 1 time a week 30 mg tablet we will give. The mechanism of action, this is the anti-estrogen effect. So this will not allow for the implantation and it will not allow for the fertilization of the ovum. So this is the mechanism of action of the our centchromen. So that is, it prevents the fertilization and it prevents the implantation. Very important. And the very important point is that is the dose schedule of this one. This is the very important. First 3 months 2 times in a week, that is the twice weekly 30 mg, and after the 3 months that is 1 time a week, that is the once weekly 30 mg is the correct answer. I hope you understood this one. So when we have to start this one, so we have to start this one on the day 1 of the menstrual cycle. Okay, so this is contraindicated where the liver disease is there, where the thromboembolic disorders are there, because you know it is stimulating the estrogen receptors and estrogen is activating. Estrogen is activated means what happening? Estrogen is activated means the risk of the bleeding is there. So risk of the clot formation is there. So that is the reason in a patient with a deep vein thrombosis, in a patient with a pulmonary embolism, and if the patient with any thromboembolic history, we should not give the our centchromen also. We should not give the oral combined pills also. So we should not give the hormonal replacement therapy also. Very important to be keep in our mind, because estrogen is increased, it means risk of the thrombus formation is increased. So that is the very important point you have to keep in our mind. And this is, it is also not given in the hormone dependent cancers are there, in that one it is not given. And pregnancy, absolute contraindications for all type of the contraceptives. So in the pregnancy we should not give any type of the contraceptive. Okay, so liver disease, it will increase the risk of the liver cancer. So that is very importantly we should not be given in this one. I hope it is very much clear. And what is the brand name of this particular centchromen? So this centchromen brand names are, so previously we used to say, and in the Ministry of the Health and Family Welfare also, in the Ministry of Health and Family Welfare, so in this one also it is clearly mentioned as a Saheli, and the new name that is there in the market now is the Chaya. Sir, for the Norcet exam, which one you have to choose, sir? So you best choose as the Chaya for the next Norcet exam, because in the new market brand, so that is in the Chaya is the leading name, and in the Ministry of Health and Family Welfare leaflet also it is also mentioned the Chaya. Saheli bar Chaya they have mentioned. Okay, so Chaya in the sense this is the new name and it is also mentioned. So this was only name, previously it was there in the leaflet. Now in the leaflet of the Ministry of Health and Family Welfare, the both is there. There is the Chaya also there and Saheli also there. So but the Chaya is the new name. So this is the first priority we will give if question is asking what is the brand name of the scent chromin. In that one they mentioned both the options Chaya, Saheli, both are the like two different answers. So that time we will choose the Chaya as the single best answer. Are you getting the point? Yes sir. So I hope it's very much clear. And here it comes to the next question. Yes, just now asked the question. So what is the chemical name which is present in the scent chromin? What is the chemical ingredient or the chemical name of the scent chromin we have just discussed? And I told that's the very important word for you all. So I want your answer now is what is the chemical name of the scent chromin? So chemical name of the scent chromin is option A levonorgestrel, option B is ethinyl estradiol, option C is ormeloxifene, option D is mifepristone. So what is the correct answer? Yes, so almost all people given the correct answer. That is the another name of the or the chemical name of the scent chromin is the ormeloxifene. So just now only we have done this one. So first statement what I told you is that is the chemical name only I told. Okay, so that is the scent chromin we also called as the ormeloxifene. So this is the very important. And here we have the second question again on the scent chromin only. So we try to answer. Just discussed a point. So that is the which of the following is the brand name of the scent chromin in India? So brand name of the scent chromin in India. So that is option A Maladi, option B Saheli and Chaya, Norplant and Depo Prevere. What is the answer? Yes, so that is the Chaya and Saheli. This is the brand name which we have for the scent chromin in India. So this is the very important and single best answer for the next Norcet. So that is the Chaya is the one single best answer because this is the recently used name and this is the new name. Okay, yes sir. And here it comes to the next very important question. So try to read the question, understand the question and try to give the best answer. The question now coming on the oral combined pills. Next 15 to 20 minutes we are going to fix one MCQ. So that is from the oral combined pills. Very important for your exam. So I will give the 5-star for this particular topic, especially for this particular concept, because one MCQ you may directly expect from the concept what I'm explaining now here. So question is very simple. Very simple question we have, that is the primary mechanism of action of the oral combined pills. So focus on the word primary mechanism of action of the oral contraceptive pills in preventing the pregnancy. Option E, thickening of the cervical mucosa only. If you are getting the options like this only, you just remove that one. Okay, eliminate that one. Okay, and option B is telling that it inhibits the ovulation. Yes, it is also responsible for the thickening of the cervical mucosa, but it is not only that one. It is also responsible for the inhibition of the ovulation. Option C, prevents the implantation only. No, this is also not correct statement. So yes, OCP can thickening of the mucosa it will do. Yes, it will do, but not only this function. So I'm eliminating this option. And preventing of the implantation it is doing. Yes, it will do, but not only this function. So I'm eliminating this one. And in the question they have clearly mentioned primary mechanism of action of the oral combined pills. So what is the primary mechanism of the option of the oral combined pills? Yes, option C, option A and D I eliminated, and you have to choose the answer from the option B and C. Yes, choose the answer from the option B and C here. Yes, almost all people given the correct answer. That is the inhibition of the ovulation is 100% is perfect and correct answer. The answer for this question goes to the option B. That is the inhibition of the ovulation, and this is the primary mechanism of action of the oral combined pills. Sir, how this will going to inhibit the ovulation? Understand that in the oral combined pills we have the two very important hormones. One is estrogen, another one is progesterone. What this estrogen will do? This estrogen will send the negative feedback to the follicular stimulating hormone. There is no follicle development in the ovary, and this progesterone is going to send the negative feedback on the luteinizing hormone. There is no ovulation. So no ovulation because estrogen is stimulate not allowing the FSH to release, and no ovulation because there is no LH. So there is a primary function we have is the, so that is the inhibition of the ovulation is the primary mechanism of action of the our oral contraceptive pills. I hope it is very much clear. Okay, yes sir. And here the progesterone is responsible for the thickening of the mucosa. Yes sir, it is responsible for the thickening of the mucosa, and it will not allow. But the primary function is, that is the inhibition of the ovulation. So here we have a very important thing just you have to understand here is, so you can understand here from the mechanism of action. So we have the first primary mechanism of action, that is negative feedback on the FSH and LH. So how means the estrogen is sending negative feedback to FSH, progesterone sending the negative feedback to LH. Okay, so here the LH is there. So that is synthetic estrogen and progesterone are suppressing the FSH and LH. Yes sir, both synthetic estrogen and progesterone what we are giving through the oral tablet, that is suppressing the both the very important FSH and LH. No FSH, no LH means there is inhibition of the ovulation. This is the primary mechanism of action of the our oral combined pills. And here we have the thickening of the cervical mucosa by the progesterone. Okay, so this progesterone makes the cervical mucosa to thick, and this will prevent the entry of the sperm. So this is also works by prevention of the fertilization. Okay, it will prevent by the fertilization, because it is not allowing for the sperm entry, but this is not in the primary mechanism of action, this is secondary. Okay, and this is also having the ability to change the endometrium. So the endometrial change become, it is not allowing for the implantation. So this is also a very important mechanism of action. But the most important thing, one thing you have to remember is this will be act by prevention of the ovulation. So this is the one very important thing, and you understand the very important concept on the oral combined pills. In the oral combined pills, so now we are calling this one as a COCP, that is the combined oral contraceptive pills. So what we are calling now, we are calling now this one as the COCP, that is the combined oral contraceptive pills. In this one we are having the two, that is the Mala N and the Mala D. So Mala D is for the distribution in the medical shop, not in the government. So this is distributed with a low cost. So like 3 rupees per pocket will be there for the Mala D. And Mala N is having the no cost. It is free. And where the Mala D we will get? Mala D we will get in the private medical shop. Mala D we will get in the private hospitals. Sir, where we will get the Mala N tablets? So this is, you will get in the all the all the primary health centers and all the sub centers and all the CHCs. Okay, on all the district hospitals, every government hospital will be having the Mala N box where it is distributed free of cost. Okay, so Mala N will be distributed with a no cost. N stands here as the no cost. D stands here as the distributed with a low cost. Okay, so full name is the Mala D oral contraceptive pills. Okay, that is the Mala N oral contraceptive pills we have. So this is N stands here as the no cost. Okay, so distributed for the free of cost is the Mala N, and this is included, N stands here, this is included in the National Family Planning Program. That is the Mala N. N is a part of the National Family Planning Program. N is no cost, that is distributed free of cost. Mala D is distributed with a low cost, that is the 3 rupees per pocket will be charged. Okay, and distribution scheme, there is a social marketing scheme will be there for the Mala D. Sir, is that in the Mala D and Mala N same tablets? Yes. So previously Mala N used to come with only 21 hormonal tablets. Now the Mala N also coming with the 21 hormonal tablets plus 7 iron tablets. Okay, so this is now both are same. So previously we used to say Mala D is having the hormonal 21 tablets, 7 iron tablets, total 28 tablets, and in the N only 21 tablets are there, that is the hormonal we used to say previously. So nowadays the government also, which is giving free of cost, in that one it is giving the a very important 28 tablets also in the free of cost also. That is the 21 is the hormonal tablets, 7 are the iron tablets. So in the Mala D, Mala N both same pocket which is coming down. Okay, yes sir. And what is the composition, sir? Is that composition of the estrogen and progesterone which is there in the Mala N and Mala D is both are same, sir? Yes, absolutely same. Okay, so these both belongs to the low dose pills category. I will teach you what is the low dose pill high dose pill, very high dose, like very low dose pill. So in that one, so just understand Mala N and Mala D both belongs to which category of the oral combined pills? This one both belongs to the low dose category. Okay, yes sir. So you understand now this one, what we are getting now, Malayan. So previously which is coming only with the this levonorgestrel and ethinyl estradiol, but there was no any ferrous fumarate. Nowadays it is coming ethanol, levonorgestrel, that is the progesterone, ethinyl estradiol, that is the estrogen, with ferrous fumarate, that is the oral tablet, that is Malayan. So this is not for sale. This is purely government supply and it is purely available only in the government hospitals. Okay, so you can see here the symbol of the National Health Family Planning also it is there here, and you can see here we have Malady. So this Malady also have the same, that is the levonorgestrel as a progesterone, ethinyl estradiol as a estrogen with ferrous fumarate. Okay, so this is for oral use in a woman. So both are the oral contraceptives. Okay, so this we will get in the like outside the hospital also, so that is in a medical shop. Sir, how we have to start this one? So this particular first tablet woman have to take on the like in a first 5 days, especially if she is taking day one, that is also okay. So but ideally, so they used to recommend that, government of India recommendation tells that, so start on the 5th days. Okay, so she is taking first tablet on the 5th day, and from that she should not take like this. This is not a correct method. So how she have to take? So woman have to start from here, then come here, then she has to come like this, because these white color tablets which you are seeing here, so these are purely hormonal tablets, and these black color tablets which you are seeing here, these are purely iron tablets. So she is taking this one for 3 days, and one tablet she is taking and maintaining a 1 day gap, so that is increases the highest risk of the pregnancy, so that we don't want. Okay, that is the reason how to take a oral combined pills. Education is must for the females. Okay, so she have to start taking this one. Okay, so from the day 1 to the day 21 she have to take this one. Okay, so in this particular direction. Okay, so after taking this one, okay, so at the 21st day she have to stop this one, and she have to start taking the very important iron tablets. Okay, so this iron tablets she have to take for the 7 days. Are you getting the point? Yes sir. So this is how we have to administer the iron tablets. Okay, so how to take the Mala contraceptive pills? So for the first for the 28 days cycle, so this is the very important thing. Just you have to understand here, we have to start this one within a first 5 days. Okay, so when we have to start this one, so we have to start this one within a first 5 days of the menstrual cycle. Okay, so from the day 1 of the starting to the day 21, so we will give the hormonal pills. Okay, that is the very important. And the most important thing after this one you have to understand here is, yes, so when to start, I told, that is start within the 5 days. Okay, so not on the 5 days, not mandatorily on the 5 days. So this is mentioned as within first 5 days of the menstrual cycle. Very important. And day 1 to day 21 is the hormonal pill we have to give. So when she is starting, that is the day 1, and up to day 21 hormonal pills we will give, and from the day 21 to 28 we will give the iron pills. So 7 iron pills we have to give, and the 21 hormonal pills we have to give. Once after immediately finishing of these iron pills, next packet she have to open, and immediately she have to start to take. If she is maintaining the gap, that is going to cause the pregnancy, that we don't want. Okay, are you getting the point? Yes sir. So here we have the next very important very important golden point for your exam. Very important table, not just a table, this is a very important table. So that is composition of the oral combined pills. So what I told, we have the estrogen and we have the progesterone. Estrogen is present in which form? Estrogen is present in the form of the ethylene estradiol, and progesterone is present in the form of the levonorgestrel. These are the questions which I was asked previously. And what is the dose, sir? So for the estrogen, that is the ethinyl estradiol we have, that is the 0.03 mg or the 30 microgram. Very important. 0.03 milligram or the 30 microgram is the dose of the estrogen we have. And the dose of the progesterone, that is the levonorgestrel, is 0.15 mg or the 150 microgram. So this is the dose of the our levonorgestrel. So this is a very important thing. Just you have to keep in your mind. Okay, yes. And based on the amount of the estrogen which is present, the oral combined pills are divided. Okay, so oral combined pills are classified which is based on the estrogen. Okay, so that is the very important thing. So it is classified into three categories. That is, you can understand here. So that is three categories I told. One is the high dose pill we have, another one is the low dose pill we have, another one is the very low dose pill we have. Okay, yes sir. So when we can say this is the high dose pill, if the estrogen amount inside the pill is more than 50 microgram, that is the high dose pill. And the estrogen amount is more than 20 to 50 like in between the 20 to 50 microgram, this is the low dose. If it is less than 20 microgram, that is the very low dose, where the our estrogen inside the our mala, like mala and maladi, how much it is? So that is only 30 microgram. 30 microgram means the mala and maladi belongs to which category? That will belongs to the low dose pills. These both belongs to the low dose pills category. This is the very important point to be keep in our mind. Okay, yes sir. And we have discussed already mechanism of action. Here it comes to the next question. So I want the brilliant answer for this one. So try to choose the correct answer. Yes. So here we have the question. A woman is there, so who is taking the oral combined contraceptive pills, and she vomits within a 2 hours. What is the best appropriate advice you have to give to that particular woman? So what happening here? So woman is there, she is taking the oral combined pills. Okay, so that woman, she have vomited that particular tablet within 2 hours after taking the tablet. So what is the advice as a nursing officer you have to give this particular patient? Option A is there, skip the dose and continue the next day. The nurse is telling to the patient to skip the dose and continue the next day. So this is not a correct statement. If woman is vomited within 2 hours of taking medication, so what we have to educate is repeat the same dose of the OCP as soon as possible. If she is vomited within 2 hours, after 2 hours, skip the dose and continue the next day as per the same schedule. Okay, so because after 2 hours she is vomited, it means the medication almost absorbed. Okay, if within 2 hours, sorry, after 2 hours she vomited means almost medication is absorbed. So we should not repeat the dose. Okay, if she is vomited within 2 hours of taking the medication, so we have to repeat the same dose of the OCP as soon as possible. So this is the very important point. Just you have to keep in your mind. Okay, so repeat the same dose of the OCP as soon as possible. And here are the some scenarios for your exams. So that is what to do when the pill is missed. So this is very important table for your exam. Try to understand the concept what I am trying to teach you here is, so when the woman is taking the oral combined pills regularly, but she have forgotten and she have missed the dose. What to do if one dose is missed, and what to do if more than one dose is missed, and what to do if the more than 3 doses is missed. That is the concept you have to understand here. If there is an one dose or the 2 pills are missed, what we have to educate, take the hormonal pill as soon as possible. This is the very important thing to be given. Take the hormonal pill as soon as possible, or take the 2 medications of this pill, whatever the medication, the tablets she is taking. So we will educate, take the 2 pills at the scheduled time, that is the next day. That is the next day. So that is, if she remember as soon as possible, like morning 8 a.m. she used to take and she forgot, and she remembered at the 10 o'clock. What is your education? We will educate, take it immediately now. Okay, otherwise see how forgotten the medication in the morning, and at the night she is remembering that she have not taken the tablet in the morning. So what to do that time? So that time we have to educate, take the two tablets or the two pills at the scheduled time next day. Means next day morning she have to take the two medications, and there is no any risk of the pregnancies if we miss one tablet or two tablet. So there is little risk or there is no risk. We can say there is extra protection not required. But if there is three doses or the more than three doses are missed, so what we have to educate is take one hormonal pill as soon as possible. So remember, and continue the remaining schedule as per the same schedule. And here there is a 3 days miss is there, so risk of the ovulation and the pregnancy is there. So what we have to educate, use the backup method for the next 7 days. Backup method in the sense, along with the taking the oral combined pills, use the condom for the next 7 days or the next 1 week. So because this woman have missed the pill for the 3 days, so that is increasing the risk of pregnancy. So that is the very important thing. See how to what we can say, see how to take the medication as soon as possible. So remember, and use the backup method for the next 7 days. So that is especially condom to be advised. Okay, so that is the very important. And if the female have had the intercourse in the last 72 hours, and now she remember that she have not taken the medication in the last, if the female had the intercourse in the last 72 hours, so we have to, like, without using the medications, without taking the medication, she had the intercourse in the last 72 hours means, so that time we we have to also consider the emergency contraceptive pills here. So we have to give the e-pills, otherwise pregnancy possibility is there. Okay, yes sir. And if the female is vomited, so the oral combined pills have the side effect of the nausea and vomiting. So vomiting within 2 hours of the taking the OCP happen means, what we have to do? So that is, vomit within 2 hours happen means the dose to be not absorbed. Okay, so the dose may not be absorbed here. Okay, so repeat the same dose of the OCP as soon as possible and continue the same schedule as per the our regular schedule that to be continued. Okay, so if more than 2 hours then vomited, no need to repeat the dose. Within 2 hours vomited, repeat the dose. I hope it is very much clear to every one of you. And here it comes to the next very important question. So please do read the question carefully, completely, and try to give the best answer. Which of the following is a non-contraceptive benefit of the combined oral contraceptive pill? So we are using the OCP for the preventing the pregnancy and for maintaining the space. So that is the main purpose of the our oral combined pills. So that is for the contraception. Other than the contraception, what is the other benefit the OCP is having? Non-contraceptive benefit of the combined oral contraceptive pill means, other than the prevention of the pregnancy, what are the other benefits actually our oral combined pills are having? So this is the question in front of you all we are having here. So what is our answer? Option E, increased risk of the ovarian cancer. No sir, if the patient is taking the ovarian like OCP, it will decreases the risk of the ovarian cancer. Option C is the permanent infertility. No, it will not cause the permanent infertility. Once you stop taking the tablet, so you can get pregnant. So that is the means it is the reversible, it is not irreversible. So it is not in the correct answer I am removing. And severe anemia is not a extra benefit. So this is the loss actually we have. So that is not a correct answer. So the answer for this one is a very clear, where the following is a non-contraceptive benefit of the combined oral contraceptive pills. So that is the protection against the ovarian and endometrial cancer. So this is the best and the very best answer. That is the protection against ovarian and endometrial cancer is the extra benefit where the oral combined pills will give to us. Okay, so this is a very important one you have to understand here. Okay, and here we have a very important non-contraceptive benefits of the oral combined pills and why it happens and how it happens. You understand here. Whenever there is the more estrogen will be there in our body, that is the natural estrogen. If the natural estrogen is more in the body, that will increase the risk of the cancer of the ovary, that will increase the risk of the cancer of the endometrium, that will increase the risk of the endometriosis and fibroid of the uterus and colorectal cancer. This risk will be increases when the natural estrogen will increases. When we will give the synthetic estrogen from outside, so that is in the form of the oral combined pills. In the oral combined pills, what we have? Estrogen and progesterone. That is the synthetic estrogen. That is not natural estrogen. That is the factory made estrogen. Getting the point? So when we will give the whenever we will give the like non-natural, that is the synthetic estrogen from the outside, inside the body we are giving. So that time what happens? The synthetic estrogen will increases, means the natural estrogen will decreases. When the natural estrogen is decreasing, means it will decrease all the problem which is associated with the increased estrogen. So you can understand here, combined oral contraceptive pills, it will suppresses the natural estrogen. It will decrease the natural estrogen, and it will also suppress the natural progesterone. So when the natural estrogen is decreased problem associated with the increased estrogen, because when the estrogen was increased at that time, the fibroid was happening, endometrial cancer was happening, endometriosis was happening, ovarian cancer was happening, and the colorectal cancer was happening. When it was happening, when the estrogen is, especially natural estrogen was increased. So now OCP is what doing? So OCP is suppressing the natural estrogen. OCPs are suppressing the natural estrogen, means there will be a decreased risk of the uterine fibroid, decreased risk of the endometrial cancer, decreased risk of the endometriosis, okay, and decreased risk of the ovarian cancer, and decreases the risk of the colon cancer. So these are the very important extra benefit we will get when the woman will be taking the very important oral combined pills. Are you getting the point? Yes, sir. And here we have the next question. So read the question properly, perfectly, and try to give the best answer. Which of the following is an absolute contraindication for the use of the combined oral contraceptive pills? This is the question for you all. Which of the following is an absolute contraindication for use of the combined oral pills? Yes. Absolute contraindication for the OCP. Option A is the mild anemia. So mild anemia is not in the contraindication. So option C is the irregular menstruation. So actually in the irregular menstruation, if we are giving the oral combined pills, that will make the irregular menstruation into the regular menstruation. And in the dysmenorrhea, we are giving the OCP, means that will reduce the pain in the menstruation. Yes, so the dysmenorrhea treatment we can give as the OCP, irregular menstruation which we can give as the OCP. So the irregular menstruation, anemia and dysmenorrhea, these all are not contraindication for the OCP. So we can give the OCP here, there is no problem. But if in case the patient is having the any risk of the thromboembolism, that is the deep vein thrombosis, pulmonary embolism, stroke risk. So in all the patient, if the already patient is having the history of the thromboembolism, history of the stroke, history of the DVT, history of the pulmonary embolism, giving the oral combined pills is absolutely contraindicated, because in the oral combined pills we have the estrogen. That estrogen will increase the clotting. So when the clotting is increased, the risk of the thrombus formation again increases, and the thrombus formation is increased, means risk of the stroke will increases, risk of the pulmonary embolism increases, risk of the deep vein thrombosis increases. So that one we don't want. Okay, so if the past history of the thromboembolism is there, so this is the absolute contraindication for the oral combined pills. Okay, so for taking the oral contraceptive pills, so this is the absolute contraindication we have. Okay, so I hope it is very much clear to every one of you, right? Yes, sir. And here it comes to the next question. So that's next concept. So how we have to remember this whole thing? Remember, where all are the oral combined pills are absolutely contraindication, where all are you should avoid the OCPs. Okay, so you have to avoid the OCP in a 35 smart O. So where you have to avoid the OCP, you have to avoid the OCP in a woman who is having the 35 smart O. Okay, so in a man it is not useful. No? Why the men will take the OCP? Men will not take the OCP. Okay, so it is men also it should be avoided, and in the woman with the 35 smart here also you should be aware the OCP. So what it means, sir? So this is the mnemonic you have to understand. Okay. So 35 smart O means, so that is the 35 in the sense, if woman is having the smoking and her age is more than 35 years, so this is absolute contraindication. So smoking woman above the 35 years, so this is the absolute contraindication of the OCP. Very important, you have to remember. Okay, yes sir. And what is the smart? That is the yes stance. Yes stance here, the severe hypertension is there. So here also OCP is absolutely contraindicated. What is the M? EM stands here is the migraine with aura. So migraine is there with the aura. So there here also the OCP is absolutely contraindicated. And the next one is the A. A stands here is the arterial disease like a stroke, like a ischemic heart diseases we have. So here there is in the risk, again there may be a chance because the clot will be increased because of the estrogen which is present inside the oral combined pills. So in the arterial diseases like a stroke we have and the ischemic heart disease we have, so here also absolutely the OCP is contraindicated. And recent R in the sense that is the recent history of the thromboembolism, especially deep vein thrombosis and pulmonary embolism. So from here only we will get the question. So this is a very important point you have to keep in your mind. So three things only you tell me where I have to keep in your mind. One is, that is, smoking with a woman more than 35 years, OCP is absolutely contraindicated. Second one is arterial disease like stroke and ischemic heart disease, the OCP is contraindicated. And recent thromboembolism, that is the deep vein thrombosis and pulmonary embolism, OCP is absolutely contraindicated. And the third one is, that is a woman who is giving the breastfeeding. Okay, so in a breastfeeding mother, oral combined pills are absolutely contraindicated. Okay, so and along with this one, the tumors, so that is especially a tumor of the breast, so it will increase the breast cancer, especially the malignant breast cancer, it will increase, so it is absolutely contraindicated. And woman with the liver and gallbladder disease, W stands here is the woman with the liver and a gallbladder disease. So woman with the liver and active liver and active gallbladder disease is there, so here the OCP is contraindicated. And the ongoing pregnancy, currently the woman is pregnant, so here also OCP is contraindicated. 35 smart O is the very important mnemonic you must and should remember. Okay, so here the smoking woman above the 35 years, so that is contraindication of the OCP. Severe hypertension and migraine with aura, arterial disease like a stroke and ischemic heart diseases, and the recent thromboembolism history where the clotting risk is more, so where we have to avoid the OCPs. And tumor of the breast, avoid OCP. Woman with the liver and gallbladder disease, okay, avoid the OCPs. And ongoing pregnancies, avoid the oral combined pills. So this is a very important, all the contraindications of the our oral combined pills you must and should remember. Okay, these are the contraindication of oral combined pills, that is actually absolute contraindications of the OCP, so just you have to remember. Okay, I hope it is very much clear. And here it comes to the next question. So try to read the question properly, perfectly, and try to give the best answer. Yes. Which of the following contraceptive method is preferred for a breastfeeding mother? So which contraceptive method is best preferred for the breastfeeding mother? In the option we have combined oral contraceptive pills, that is the OCPs what we have discussed till now. And option B is the progesterone only pill. Option C is the estrogen only pill. And option D is the no contraceptives method are preferred in the breastfeeding. So what is the answer? In the breastfeeding woman, we can give IUCD also, and we can give the contraceptives which is not having the estrogen. Why, sir? Why? Because the estrogen which is there here, that is going to suppress the prolactin. So if the prolactin is reduced, there is no breast milk production. The mother is breastfeeding mother, and we are giving the oral combined pills. In the OCP we have the estrogen. That estrogen is suppressing the prolactin. So prolactin is suppressed, means no breast milk production. No breast milk production means how the baby will drink the milk. So that is the very difficult. So that is the reason, very importantly, how to understand here. So The very importantly, the OCPs are absolutely contraindicated in the pregnancy. Okay, sorry, in the breastfeeding mother, right? Yes, sir. The oral combined pills are not correct answer, because the oral combined pills, it is having the estrogen, so that is the reason it is not given. Okay, estrogen only pills, again, estrogen is suppressing the prolactin, so that is the reason we will not give. And we have the option D, that is the do not have the, no, we have the methods, that is the, we have the progesterone only pills, and we have the like IUCDs also we have. So the very importantly, the best one, the best option for the breastfeeding mother is the progesterone only pills, or the mini pill is the best method for the breastfeeding mother, where we have to give. In the progesterone only pill, we don't have the estrogen. Not having estrogen means no any inhibition of the prolactin. So no inhibition of the prolactin, no like inhibition of the breast milk production. So breast milk will produce normally, and mother will feed normally to the baby. So there is no any problem with the progesterone only pills. The best oral contraceptive for the breastfeeding mother is that is our progesterone only pill we have. Okay, I hope it is very much clear to everyone of you. And here we have the golden points for revision. So already we have discussed these points. Combined contraceptive pills are absolutely contraindicated in the breastfeeding mother, especially during the first 6 months of the postpartum, because estrogen will reduce the milk production and may affect the infant's feeding, because estrogen will be inhibiting the prolactin. So that is the reason it is not given. And progesterone only pill we have, progesterone only pill. So this is do not containing the estrogen. It is not containing the estrogen, and do not reduces the breast milk production. It will not reduces the breast milk production. Therefore, they are safe and preferred in the breastfeeding mothers. Very important. Clear statements from your K-Park book. Okay. So here we have the exam golden points for remembering. Best oral contraceptive for the breastfeeding woman. Best oral contraceptive for the breastfeeding woman is that is our progesterone only pill, or the mini pill is the best oral contraceptive for the breastfeeding mothers. Okay, and progesterone only pills containing the progesterone alone and do not containing the estrogen, so this is the best one. Okay, and mechanism of action, it is only containing the progesterone. So how it will work, what is the action of the mini pill or the progesterone only pill? So the mechanism of action of the progesterone only pill is this particular progesterone which is there inside, which will causes the thickness of the cervical mucosa. So when the cervical mucosa become thick, it will decreases sperm entry. It will decreases the sperm entry. So if it is decreasing the sperm entry means it will inhibit the ovulation. So there is no sperm entry means how the, sorry, it will decreases the sperm entry means it will decreases the fertilization. So there is no sperm entry means how fertilization will happens, not happens. Okay, so that is progesterone only pills works by inhibiting the fertilization. Okay, and this particular progesterone only pills, this will produces the negative feedback on the LH, because you know progesterone is responsible for the sending the negative feedback. So this is sends the negative feedback on the LH. There is no LH means there is no pregnancy, so it prevents the ovulation also. So that is the very important in a breastfeeding mother. If you require, so you can give the progesterone only pills, because it will inhibit the fertilization also, it will inhibit the ovulation also, and it is not having the estrogen, it will not hamper the breast milk production. So I hope it is very much clear. Okay, and most common side effect of the progesterone only pills is this will cause the irregular menstrual bleeding. So this is the most common side effect of the progesterone only pill. Okay, just give me a second. Yes. So here in a breastfeeding mothers, all the progesterone only pills, like all the progesterone instrument what we have, all the progesterone devices what we have. For example, we have the progesterone only pill for the oral contraceptive. We have the progesterone IUCD. So we have the progesterone implants, and we have the injectable progesterone, that is the what we call the Antara or the DMPA. So these all are safe in the breastfeeding mothers, because these are all not containing the estrogen. Okay, so DMPA is safe in the breastfeeding. Implanon is safe in the breastfeeding. progesterone only pill is safe in the breastfeeding, and hormonal IUCD is also safe in the breastfeeding. So these all are safe in the breastfeeding, but these all not used as in the emergency contraceptives. Okay, so remember here we have the very important statement, safe in the breastfeeding mothers. So that is all the progesterone only methods. So that is the progesterone oral, we have the progesterone POP, that is the mini pill what we have, progesterone only pill, and progesterone injectable, that is the DMPA or the Antara we have, and the progesterone implant, so that is the implant one we have. So these all are safe in the breastfeeding mothers. Okay, so these methods used for the regular contraceptives, and these are not used for the emergency contraceptive methods. So this is you have to keep in your mind. Okay, yes sir. And here we have the next very important question. So this is on the DMPA injection administration, and this is one of the very important question again for your exams. So please do read the question carefully, properly, and try to give the best answer. So question is very simple. How often is DMPA injection is administered? Option A, once in a month. Option B, once every 3 months. Option C, once every 6 months, and option D, once in a year. So what is the correct answer? Don't get confused between the centrochromine and the DMPA. Centrochromine, Saheli or Chaya. So that is for the first 3 months. In a 1 week, 2 times we are giving. That is a twice a week in the first 3 months. After the 3 months, that is once in a week we are giving. That is the centrochromine or the Chaya or the Saheli. So DMPA is the injectable progesterone. So centrochromine is the non-hormonal, non-steroidal. So the DMPA is, this is the hormonal, and this is the progesterone injection which we have. That is depot medroxyprogesterone acetate is its full name. Okay, so how often DMPA injection is administered? That is the question. So option is the very clear, and almost all you people given the correct answer. That is the once in every 3 months this particular DMPA injection is administered. Okay, so this is very important. Okay, yes sir. And here we have the DMPA injection. So the full form of the DMPA have been asked in your exam. That is the depot medroxyprogesterone acetate. So here we have the which hormone? That is the progesterone. Okay, yes sir. And DMPA is the long-acting hormonal contraceptive. So this is also comes under the LARC method. Okay, and the dose of this one will be 150 mg. And how we are injecting this one? We are injecting this one in a intramuscular route. Okay, what is the route of administration of the DMPA? So route of administration of the DMPA is the, so that is our intramuscular. Very important. How much? 150 mg we will give. Okay, and this is given every 3 years. Sorry, every 3 months once. That is every 12 week. Okay, so 12 week in the sense, in a 1 month, how many weeks we have? 4 week. So 4 week plus 4 week plus 4 week. That is a 12 week. It means every 3 months, one time we will give the injection DMPA. That is the depot medroxyprogesterone acetate. That is the injectable progesterone we have. Okay, and very importantly to be keep in our mind, this one will be given by the intramuscular route. Okay, and what is the action which is having? The progesterone is having means, so this one will prevent the, and it will sends the negative feedback to LH. No LH, no ovulation. So it will prevent the ovulation. And progesterone is there. It will do the cervical mucus thickening. So it will block the sperm entry. So that means no fertilization. And this will cause the thin endometrium. So it means no implantation. So the DMPA works by preventing the ovulation, by preventing the fertilization, and by preventing the implantation. So these are all the very important words you have to keep in your mind. And the most common side effect which you have on the DMPA is the, so that is amenorrhea. So this is the very, very important class what we have discussed here, and I hope you enjoyed the session. Okay, so we have a few more concepts to understand. So that one I will take in the next class. I hope you enjoyed this very session, very like as a very important session we have conducted this one, and from here you may expect at least 2 question or 3 question in your exam considering the last and this session. Okay, so please do revise this one properly without missing a single point, and I have added only important point in this one. So from here you may get the highest chance of getting the question is there. So if you are new to our MNC family, so please do subscribe to the channel and share this video with your friends. And if you are still searching for the best quality test series in the India. So please do download the master nursing classes where the 20 plus AIMS experts are means completely updated knowledge experts are working behind the screen, so to give the best test series for your practice. Okay, so you can attend the test series, and we will give the free also in the every Sunday, so you attend that one if you want the daily best practice and the best rank, so that you can choose the test series and practice daily. Okay, so I have given the app link in the description box. Okay, from there you can download the app. Okay, so thank you so much for watching the video till here. Bye bye, take care. We will meet again in the next class. Bye bye, take care.